The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us for the Shelter Diversion 1.0 training. I am Amber Freeman, the Training and Technical Assistance Coordinator with the Connecticut Coalition to End Homelessness. Now, I see we still have people that are joining us, but we have a good amount of information that we're going to cover today. So we're going to go ahead and get started. But before we begin, I just want to go over some housekeeping. So because this is a webinar, you all are all muted. However, you can type any questions that you have at any point during the training inside of the questions box, and we'll be sure to get to them during the training, or if not, we'll definitely get to them after. We will be having a questions and answer segment. Also, this training is being recorded, and the recording as well as the webinar slides will be sent out to you following this training, and it will also be available in our webinar library at www.cceh.org. Now, when you go to our website, you can go to our resource tab and you'll see webinars, and you'll have a full list of all the different trainings and webinars that we have recently done. So for today's training, we have Diana Berube, who is our Program Manager for Prevention and Exit Strategies with the Connecticut Coalition to End Homelessness, as well as myself, Amber Freeman, and again, I am the Training and Technical Assistance Coordinator with the Connecticut Coalition to End Homelessness. So I see we have a large amount of people joining us today from many different walks of life, different organizations. We have some municipalities, we have different shelter providers, different case managers, private practices, schools. We have a large group. So before we actually get into the training, I'm going to ask Diana if she can just give an overview on Connecticut Coalition to End Homelessness, speak a little bit about our mission, our vision, who we are, and then we'll go ahead and start the training. So, Diana.
Thank you, Amber, and thank you all for joining us this morning to go over the broad overview of what shelter diversion is as a practice. And as Amber stated before we begin on that topic, just to give you a little overview of who CCEH is as an organization. We are the lead organization in Connecticut. Our mission to end homelessness and vision is to have any episodes of homelessness across the state for individuals and households be as rare, brief, and one time. In order to do that, we provide a voice to nonprofit organizations, municipalities, and homeless service providers across the state. At CCEH, our roles and functions include administering our statewide data system, that is the Homeless Management Data Information System, that is HMIS. Within the administration of that database, we also have a great, robust data and analysis team that works through providing numbers of how many folks are experiencing homelessness. We use that information to inform and influence our practices, best practices across the state, and policies related to ending homelessness. We provide, such as this morning's workshop on shelter diversion, training and technical assistance to our providers across the state to help them learn and implement those best practices. Our advocacy team works with educating our elected officials in order to advocate for the best resources that we need to end homelessness in our state. We work in local collaboration to support our communities and ensure quality services through community impact. And lastly, we provide some direct client financial assistance that our providers can access through CCEH in order to fill the gaps in emergency resources to help our frontline workers do the best job that they can to keep people from having to enter emergency shelter or experience homelessness. So our agenda for today, as Amber said, we've got a pretty packed agenda, and we will do our very best to make sure that we have some time at the end for some question and answer. What we are going to go through this morning is what is shelter diversion as a practice. That term shelter diversion can mean many different things based on what organization, what agency you're working for, who you are in the community, and how you're meeting with clients. why shelter diversion work is so important to our state and to ending homelessness. We'll touch a little bit about how diversion practices have changed during COVID, the tools and skills that you might need to do effective shelter diversion, a little bit about resource mapping within your local community to provide some referrals to other services for clients that are in housing crisis, and lastly, how to access our flexible financial assistance through CCH. So with that, I'm going to turn it back to Amber for a little bit about why we do shelter diversion.
Actually, Diana, this is all yours.
This one's mine. Okay, sorry about that. Okay, so shelter diversion is a practice that prevents and ends homelessness. Really, it is a strategy that captures individuals and households that are at what we call the front door of homelessness. So those that are imminently homeless, on the brink of homelessness, but have not experienced living out on the street or in a place not meant for human habitation, or having to enter an emergency shelter. So our goal is to help people identify immediate alternative housing arrangements, whether that's keeping them in a stable housing situation that they're currently in, or moving them to another temporary situation in order to help them develop a long-term housing plan. So we really work very hard as a state amongst our providers, our community partners, to make every effort possible to divert clients to even temporary, more stable housing situations rather than experiencing any kind of homelessness. So that brings us to the CAN system overview, and those of you that do not work within our homeless service response system in the state of Connecticut, the acronym CAN stands for our Coordinated Access Networks. We're broken up into 7 networks across the state so that our community partners can really work well together to ensure that anybody experiencing homelessness can exit quickly into stable housing. So the way that our response system works, this is kind of a flow chart diagram to give you a broad overview of the scope of our work. We have one general central hotline that is 211 that anybody across the state, individuals or families, can call if they are experiencing a housing crisis. They will have a quick up to 5-minute phone call with a call specialist at our United Way call center to explore other options and hopefully divert them briefly and quickly over the phone, with the possibility of some referrals to other services across the state that might assist them. If that brief conversation is unsuccessful and the client needs further support, they are referred to a CAN appointment and assessment that happens region specific. So someone in Hartford will get an appointment in Hartford with a diversion specialist that can have a longer, more involved conversation about what their housing crisis looks like and how we might be able to assist them to divert them from homelessness. Again, if that conversation is unsuccessful, the client would move through to either a referral to an outreach worker for those that are experiencing literal unsheltered homelessness. They may be placed on a prioritized wait list in order to enter shelter, as we have very few shelter beds and they remain full. That is exacerbated by our COVID-19 health crisis in trying to keep as many people from shelter as possible and decompressing the shelters to limited shelter beds. So we have a prioritized wait list of those that are waiting for a shelter bed. At any point during that process, the clients would be asked to conduct a brief survey that gives them access to being on what we call our by name list. That is a full, extensive list of all of those that are experiencing literal homelessness across the state and that are potentially in need of housing interventions that we can provide through one-time. It can be anything from a quick, rapid exit, one-time financial assistance, to a further rapid rehousing with some case management. And for those that are in the highest level of need, may end up being referred to a more permanent supportive housing program that is ongoing financial assistance and a a deeper level of case management for those individuals. This is just a brief overview of the map of the state of Connecticut and how we are broken up into our 7 coordinated access networks. We've got the Fairfield CAN, Greater New Haven, Meriden, Middlesex, Wallingford, Waterbury, Litchfield, Central CAN, which is New Britain, Bristol, in the middle of the state, Greater Hartford, and as you can see, on the right side of our state, that full long yellow section is our Eastern CAN. Each of the providers in those CANs have region-specific services that might be available, but we do a great job at CCH to kind of streamline all of those services so that you have the same experience, client experience, no matter where you are in the state of Connecticut. Prior to setting up our CAN system within the state, we had been working, off and on with different community partners, and we really try to keep those conversations going to educate not only our child welfare system, social service agencies, our hospitals and schools on the practice of shelter diversion and why it is so important to remain our focus being on housing solutions rather than trying to get folks into our shelter system.
All right. Thank you, Diana. So Diana just gave a little bit of information on shelter diversion. I'm going to go into a little bit about why we do shelter diversion. Shelter diversion is extremely important. Obviously, we want to keep an individual out of our system. So we want to prevent experiences of homelessness. Whatever we can do to avoid someone being entered into our system, that is our ultimate goal. Shelter diversion also better utilizes our resources. The less individuals that we have in a shelter, it is better for our overall system. Also, it's cost effective. We're going to go into that and just show a comparison as far as the dollar amount, of diverting someone from a shelter and then the costs associated with someone being in a shelter or being in a program. It also reduces trauma. If you are in a shelter, that's not a space of your own. Everyone deserves to have their own home. Everyone deserves to have their own bed. And you're around individuals that you have not been around before. You may have experienced trauma in the past. And putting someone in the shelter, it can re-traumatize them, which we want to avoid. And we also want to reduce repeat experiences of homelessness. We don't want someone to continue to experience homelessness. As we always say, we want homelessness to be rare, brief, and non-reoccurring. So shelter diversion is the best way to do that so that someone is not having repeated episodes of homelessness. There's other reasons to implement diversions. There's tons, but we'll just start with it improves our system outcomes by reducing the entries into homelessness. Having outcomes is something that's really important. And obviously one of our most important ones is we don't want to see people being entered into our system. We want to reduce that as much as possible. Also, it improves the quality of life by helping people avoid the stress of shelter stays. It's stressful. It's stressful. I can't emphasize that enough. And if someone has another place where they can go, if someone has a family member where they can go, if someone is able to access some type of rapid exit or prevention funds instead of being entered into a shelter, then that is the best solution. And with doing so, we're improving their quality of life because it's not stress that they have to go through and experience that. It also conserves and targets our resources. And if you're diverting individuals and, it's less people going into the shelter, then the shelter beds are being used only when necessary for those who truly, truly need it. And also it cuts down on our shelter wait lists. We oftentimes will put someone on a wait list if there's not a shelter bed. One of our goals is we want to reduce our shelter wait list. We want to have an actual outcome. So if it's less people that are going into the shelter and more people that have other options, another means of having housing, then it cuts down on the amount of individuals that actually have to enter the system. And Diana, I'm going to hand it back over to you.
Thanks, Amber. Yeah, so as Amber alluded to, shelter diversion as a practice is just cost effective. You know, we have limited resources to help the homeless population within the state of Connecticut, limited resources at the shelters. And so diversion assistance can really be very cost effective. It can be something as little as some mediation with family or friends, the possibility of purchasing some gift cards for food. Oftentimes it's a bus ticket, a Greyhound bus ticket, when we can identify family or supports that maybe a household just needs to get to. It can be assistance with utility bills as low as, you know, $200. And it can oftentimes be some rental assistance for those that are living at the poverty level, oftentimes having the time to save up for a security deposit. Within this pandemic, you know, oftentimes landlords are asking for a double security deposit in order to rent to the clients because they're unwilling to take a chance because of the eviction moratorium, or a lot of those cases, we're finding the housing stock is a little bit more difficult. And so saving up that upfront cost to move into a new apartment can often be difficult for those that are at the poverty level. And so when we look at the converse side of this, it's much less expensive than having somebody enter a shelter, maybe get matched to a rapid rehousing program. And for those that are experiencing street homelessness, often those folks utilize our hospitalizations, our Department of Corrections, incarceration. Emergency services are more expensive for those individuals, and we bear that burden as a state, rather than if we might be able to come up with some lower cost housing solutions and some assistance for clients. It can really be very cost effective. Again, as Amber alluded to, a shelter stay or an experience of homelessness can really be traumatizing for a family, especially for children. And so when we look at what an ACEs score is, we can see through our data, through studies, that children that have experienced homelessness, that have gone with their family to an emergency shelter, oftentimes have greater negative health outcomes. They may experience asthma, respiratory infections, ear infections, more hospitalizations. And I think it's really, really important to keep at our forefront and understanding that for a child experiencing homelessness, it is a great predictor of future episodes of homelessness. As they grow into adulthood, those individuals are more likely to return to homelessness. And so our mission really is to keep our episodes of homelessness as rare, brief, and one time for any of those individuals. So quickly moving families into stable housing or getting them out of shelter as quick as possible is really, really important for the traumatization of children. I like to share this photo because I think it's important, and really in our shelter diversion conversation, educating the general public and dispelling any misconceptions or myths about what an emergency shelter is, what its use is, what its need is, and what it looks like for folks. So this picture kind of gives you a little overview of what a single men's dorm or single women's dorm might look like. Often family spaces is slightly different, but it can also be very little privacy and shared space with other families, kind of on top of other individuals that are in their own crisis mode. And so that little bit of privacy that you're lacking in a shelter can contribute to any trauma somebody might experience and having to go there. So part of that piece of education about our shelter realities is teaching people that across the state of Connecticut, we really have worked very hard to remain housing first focused and keeping our shelters as low barrier as possible. So with that, it's a reduction of the rules and policies that a shelter might implement in order for somebody to go and utilize their services. One of those low barrier policies is that our shelters are what we call wet shelters. That means that anybody that is experiencing active substance abuse will not be turned away. There are, of course, safety rules and procedures for anybody that's creating any kind of unsafe situation for themselves or someone else, but we do allow for individuals that are actively using substances to come and lay their head at night. That's important information, you know, for individuals, especially those that are in recovery, to know before entering an emergency shelter. Again, little privacy. There are safety rules and precautions, but you know, something to take into account. Minimal staffing and limited resources for the shelters to run their operations. Oftentimes, shelters have limited hours that clients can access, so they can come in at night and sleep and lay their head, take a shower, get a quick breakfast in the morning, but usually the clients are not allowed to stay during the day and they have to find somewhere else to go. A congregate setting during a pandemic is not ideal, and so we've worked very, very hard within our state upon the pandemic hitting last March to decompress our shelters, moving shelter residents into hotels temporarily to limit the amount of contact that people would have with other individuals, to ensure social distancing. And I think it's really, really important to note in the shelter diversion conversation that an emergency shelter is really just a temporary solution. It's never a housing fix. Shelters across the state of Connecticut typically have a 90-day stay, and while clients, you know, may be qualified for an extension of that stay, we really, really work very, very hard to make sure that any shelter stays are as quick as possible and get people into stable housing. So, you know, when it's a case where maybe there was a family argument and somebody had to leave with no other place to go after a 2-week stay and they return back to that family, really we're looking at trying to have those conversations before the shelter stay happens, to do whatever we can to mediate and keep families together, keep folks in stable housing. We like to use this coordinated assessment analogy, comparing our front door of our homeless response system in the same way as a triage would happen when somebody walks into an emergency room for medical attention. So we're equivalating our housing crisis with a medical emergency here, and that's where this analogy fits in. So to think about somebody walking into an emergency room and identifying that they maybe have a sprained ankle would be very different from somebody walking into an emergency room and complaining of chest pains and maybe having a heart attack. And the services that would be available, the immediate need that's identified for both of those individuals in an emergency room is very different. The person with a sprained ankle might have to sit in the waiting room for a while, receive an ACE bandage, get, you know, and get discharged that same day back to their home. Whereas the person experiencing chest pains is going to need immediate attention right away and be pulled in to see a cardiac specialist, for instance. So if we think about housing crisis, that same level of disparity is there. So somebody might be frantically calling, you know, friends, even acquaintances on a daily basis to say, I need a roof over my head tonight. Can I stay with you on your couch for one night? Versus somebody who maybe has a support that will let them stay for up to a month, but it's really still unstable. And so those two individuals are going to need different levels of housing supports. That brings us to the types of homelessness. The Department of Housing and Urban Development defines homelessness for the state of Connecticut federally in different ways. So literal homelessness refers to those that are sleeping outside on the street or in a place that's not meant for human habitation. That refers to those that might be sleeping in a car, in an abandoned building. They may have had their own lease and be in an apartment that has the electricity and running water shut off. So it's really not a suitable place for individuals to stay. And that differs from imminent homelessness, which refers to those that are at risk of losing their housing within a short period of time. Often that is defined as 2 weeks. So they may be facing an eviction, or they have family or friends that they've been staying with and they're about to get kicked out. So both of those categories would qualify for some diversion assistance. If we know that somebody is sleeping out on the street, if we know that somebody is about to lose their housing and it's going to happen within a very short period of time, those two would qualify for some diversion assistance within our state. Category 2 and Category 3 under HUD's definitions vary greatly. The imminent risk, as I said, would be that they're losing their residence within 14 days. Category 3 has a little bit more gray area, and that is that a family or a household would qualify for homeless services under other federal statutes. For example, the education system has different definitions of what homelessness means, and they include those that are couch surfing. And so some of those folks under Category 3 may not qualify for diversion assistance. And that brings me back to, the varying levels of couch surfing. When people use the word homeless, they may mean a number of different things. They may be stating that they themselves do not hold a lease, they don't have a home of their own, and they are bouncing back and forth between some natural supports. And that level of couch surfing, as I alluded to already, can be a frantic call on a daily basis, or it may mean that they have some further supports from friends or family that can allow them to stay more long-term while they come up with a better housing plan. And that brings us to how to do effective shelter diversion. The conversation really around shelter diversion is rooted in a problem-solving conversation. And in order to have an effective and productive problem-solving conversation for with those that are experiencing housing crisis, the root of that is really to create a safe space for those individuals to talk. And they should be talking more than you, and you're listening. But in order to introduce what that conversation is going to be about, is really making sure that the individual feels comfortable, not judged. You can start by briefly introducing yourself, especially if this is the first time that you're having a conversation with somebody and meeting them for the first time, to give them your name, your organization, what your role is in this conversation, what services you might be able to provide to help them out of their housing crisis, describing what the conversation is going to be about, and really asking permission to have that conversation, and recognizing that a household or individual may be sharing with you some very personal details about what their living situation is in their housing crisis. We recognize that during the pandemic, there are difficulties in creating this safe space, in that many of your conversations with folks in housing crisis are taking place over the phone versus in person. And pre-pandemic, when you could have those conversations in person, you're able to read body language, you're able to read facial expressions and tie that in with how the conversation is going, and really tailor your conversation in reflecting those things. So now our diversion specialists, our providers across the state have really honed in on their skills in listening to tone of voice, really taking pauses in the conversation. And there are some tools that we're going to have a brief overview, some tools and skills that you can hone in on in order to have those effective problem-solving conversations. One of those tools is really making sure that we are being trauma informed. So thinking about the physical and emotional safety of a client in housing crisis, creating that trust and maintaining appropriate boundaries in your conversations with those folks. We really try to be client-centered and taking into account their choices to help them come up with a plan that is their own. So that is a collaboration between yourself and the client that you're speaking with, to make sure that they're invested in the plan that they come up with. It's an empowering conversation, it's prioritizing, and it's skill building. I'm really trying to be cultural responsive, sensitive to cultural, historical, gender issues, respecting the LGBTQ community and things like that.
So just to go over a little bit what Diana was saying, that diversion is really something that happens at entry, and really we should have to change our mindset in a way. Usually at entry, sometimes people are just thinking about what type of program is someone eligible for, and is there a bed available? But really, we should change our mindset. Instead, think about what can help them resolve the housing crisis. What can be done, instead of automatically going to, what shelter has a bed available. Instead of thinking that need to get this assessment done, let's see what they're eligible for. Instead, we need to have a structured problem solving conversation about their household situation and resources. See what is available. Are there any resources? Is this something that can be solved with maybe some type of conversation with the family member to assist with the conflict that they may be experiencing? But what can be done to really help resolve their housing crisis? Spend some time on that instead of, doing the assessment, entering them into a shelter bed, completing the intake, or putting them on a wait list. Instead, we want to support the housing crisis, so that they can avoid the injury. There's tons of resources. See what resources would be of assistance. See if they are eligible for any diversion funds. Maybe it can take just a, back rent or something, and maybe that can help them so that we can save their housing instead of entering them into a shelter. So having those conversations, always being housing focused, is something that's extremely important. It's what Diversion is a part. As Diana spoke about, that conversation is essential. So when you're having a shelter conversation, you as a provider, you're listening. You're hearing what their story is as they're telling their story. Um, you're identifying any natural supports and resources as they're sharing their story and they're saying that this is their crisis. You're being solution focused, right? And providing them with any supports and resources that may be relevant for them. You're identifying and highlighting their strengths. Maybe they previously worked. Find out what was successful for them before. If they're a good communicator, what are their strengths so that you can so you can latch onto those strengths and see what can come out of it. Also, you're providing them information and guidance, and you're doing myth busting and reality testing. You're seeing, is there truly no other resolve, right? Are there any other family members? Are there any other solutions that can come out of this? And you're doing myth busting and letting them know what a shelter really is. There are rules that are there. You're going to have a lack of privacy. It's not very it may not be what they are expecting it to be. So you want to have a real conversation with them. And as the individual that is in the housing crisis, as we said, they're going to share their story, but that comes from them feeling as though they can share their story without being judged. And as you're having the conversation with them, they're going to develop their own housing plan. You're going to help them with identifying the supports and giving them resources and really helping them, but it's their own housing plan, right? It needs to be in their own words. It needs to be something that they think is attainable for them to do for themselves. Because if it's you just saying you should do this, you should do that, they're not going to want to do it, right? So it's their own housing plan and what they see for themselves. And they are going to be asking questions as far as what they may be eligible for or how the system works. And then they're going to take steps with your guidance as needed, but they're going to take steps to secure and maintain permanent housing. And that's the goal, so that they can take the steps and work towards permanent housing. A shelter, as Diana said, it's only a temporary resolve. And we want to get them to the place where they can maintain and obtain permanent housing. And it will look very different. It may consist of getting employment. It may consist of adhering to their mental health, taking steps in that direction. So it looks very different for each person, but it's their plan and what they need to do for themselves so that they can maintain permanent housing. This is all you, Diana.
Thanks, Amber.
Yeah.
Thanks, Amber. And I think it's important to note that this problem-solving conversation It happens at the front door of our homeless response system, but it's a problem-solving conversation that we make sure that all of our providers across the state are really well versed in. So a diversion specialist at the United Way call center when someone calls 211, the diversion specialists that take the CAN appointments, and if those diversion efforts are not fruitful, the shelter case managers, our outreach workers that work with unsheltered folks, are all well versed in this problem solving conversation. So this happens all along the spectrum of our homeless response system in order to work with individuals and families to make sure that a resolve can happen as quickly as possible. Some of the questions that you can pose at the beginning of a problem solving conversation are, can you tell me about why you're seeking emergency shelter today? What are the other things that you may have already tried or thought about trying before trying to seek shelter? How long have you been staying in your current situation, whether or not that is an unsheltered in a car, or if you are with family or friends or a landlord is kicking you out? How long did you live where you were before? What's the primary reason why you would have to leave, or you have already left that living situation? Where did you start getting a full scope of their housing history? Maybe they've only been staying with a friend for a couple of nights. So where did they stay before that and before that? To get a full picture of their housing crisis, how severe the housing crisis is, and what steps we can help them take to resolve that. Thinking about your natural resources, the client's natural resources, are there ways that we can assist family or friends that have already been supporting you to help that be a more permanent situation? What resources do you have right now that could help you and your family find a place? So that could be financial resources, it could be a savings account, or it could be something as simple as, you know, you have a friend or family that has young children and they need support in childcare that you can provide. So thinking about the full scope of resources that a client has at their disposal in order to help resolve the crisis.
And as
And
you
I'll let you.
having these conversations, just keep in mind that we are housing first. Everything, all of our programs are housing first. So just always stay with that mindset. And housing first is basically the belief that housing is a basic necessity that must be prioritized before an individual can pursue other personal goals and work towards improving their quality of life. Sometimes people hear, different conversations and they think that, oh, someone's not ready for housing. They're not ready to be on their own. But we all know that housing readiness is not a real thing. We believe in housing first. So first we house an individual, and then they're able to work on their other goals. That may be the thing that they truly need to inspire them to work on their other goals. So there may be some common barriers to housing that you may hear as someone's telling about their housing crisis. It's barriers. That doesn't mean that it's something that can't be worked through, right? So someone may say that they have low income, right? Or there's a lack of family or friends, or they may have substance abuse issues or criminal record, mental illness. They may have foreclosures or past evictions, or they may be a pet owner. But those are barriers, and for every single barrier, there is some type of resolve. Pet owners is something that is something new. We're going to speak about that a little later in the presentation, but that would be something that would prevent an individual from being rehoused, because what are you going to do with their pet? So there's a solution for that. We actually have some funding for pet owners. Maybe they just need to put their pet in some type of boarding, or if someone has a foreclosure or past eviction, work with the landlord, see if there's a landlord that will be willing to ignore that. For mental illness, criminal record, it can all be worked through. So just remember that we are housing focused, housing first. Whatever barrier you may hear, there is a way around it.
So now we're going to talk a brief and broad overview about some of the skills and tools that you can have within your tool belt that can assist in having a really productive diversion, problem solving conversation. One of those skills is active and empathetic listening, right? So it's really making sure that you're listening to all the details that the client is giving you about their crisis. Active listening sounds like an easy skill, and someone that, you know, is very open-minded and good at listening, you can think that this might be a skill that's honed in on easily. But pre-pandemic, we used to do in our in-person trainings, we used to do a little activity on active and empathetic listening, and I always found it really eye-opening for the crowd, that really listening to somebody, not interjecting your own judgments or thoughts, and really being empathetic to their story can be more difficult than you might think. So really kind of working on those skills, making sure that you're listening to what the client is really telling you. As I alluded to in being trauma informed, really there's a cultural awareness that we need to have, and making sure that you know your own attitudes and beliefs do not reflect on the conversation that you're having with someone. So it's checking your own biases, and even the most open-minded people really do still have some of their own biases. And so doing some self-reflection, checking your explicit bias and even your implicit bias that might be buried a little bit in your subconscious. And there's a great test that you can take in order to check those biases prior to having any conversations with clients, and really making sure that you have the best non-judgmental and really open conversation with folks. I like to use this photo of Mr. Rogers, and who doesn't love Mr. Rogers? But I think this quote really speaks to meeting clients where they're at. And so, you know, all of those barriers to housing that Amber just spoke about, you know, whether it's mental illness or substance abuse or a criminal background, really, and I'll just read this for you, but it says, love isn't a state of perfect caring. It's an active noun, like a struggle. To love somebody is to strive to accept that person exactly the way he or she is right here and now. And the reason I use this quote, and I know it's a little corny, but is because it really speaks to, and I don't expect you to love every person that you come in contact to, and they may be coming at you with anger and frustration, and they've already called 211, maybe they've been in and out of the system for years. Just being in that level of crisis mode and being in trauma, people cope with that in very different ways, and they may project some of their anger towards you in that conversation. But really taking a step back and knowing and recognizing that you haven't walked in their shoes, that you can strive to accept the person where they are at in this moment in time and now, and still give them the services and the dignity and respect that every single person that touches our homeless response system deserves. And that brings us to another tool that you can use in your tool belt to really have effective conversations with folks in crisis. So it's exploring and highlighting their strengths, and that might be something as simple as, you know, they picked up the phone and they called 211 and they put some pride aside and really stepped out of their comfort zone and asked for help. And that can be a strength in and of itself. So really helping individuals to identify times that they've been in a better place. What did it look like at that point in their lives? Who are their natural supports? Who's their go-to person when they're in trouble? Do they pick up the phone and call a best friend? Do they call a grandparent? So identifying those supports and networks, helping clients feel interdependent, not dependent on other people, but really identifying some strengths and natural supports is key to the conversation. Lastly, in your skill set, another training that you can pursue, and there's a wealth of resources. We've provided motivational interviewing, 2 workshop trainings within CCH. And motivational interviewing at its core is asking open-ended questions. So that would be, are you looking for a job? That question would be answered with a simple yes or no. If you rephrase that and ask somebody, tell me about your job search, you're going to get a wealth of more information about the person's crisis and where they're at, and that it'll give you a better sense of how you can assist the client. So really making sure that all of the questions that you're asking in that problem-solving conversation are open-ended questions. You're going to really work hard to affirm positive behaviors, that active and empathetic listening, really listening reflectively. So that's rephrasing what you've heard from the client to let them know that you've not only heard what they're stating, but you're understanding what their situation is. Summarizing can do the same thing, and really making sure that the client feels heard, and that can be a very powerful tool. Some motivational interviewing do's and don'ts. So if you're doing motivational interviewing effectively and correctly, you're going to be explaining what the conversation is going to be about. You're going to be asking permission. You're going to focus on understanding that other person's worldview. Some don'ts: don't try to solve the problem for the client, right? And you may have had a wealth of experience. You may have been with your agency or organization for years, and you've come across similar situations that have had great outcomes, and you might have some problem solving skills and ideas of your own about how a client can resolve their crisis, but really working to be client-centered focus, listening to what their choices are, what action steps they think they need to take, not giving advice, and not speaking over them or cutting them off is really important. Some responses to motivational interviewing: when it's done well, a client is going to feel understood and accepted. They'll be more willing to follow the plan that they helped put into action. They're going to have feelings of hopefulness, and they'll be engaged with you. If MI is done poorly, then the person that you're working with is going to feel judged and disrespected. They'll be less likely to follow your plan versus their own, and they might shift back towards hopelessness and disengage, to the extent that they might even put up a brick wall between you and them, and not be willing to have further conversations about what other services or referrals or assistance they might be able to get from you. So moving forward, we've used all those tools and skills within our tool belt, and we really want to come up with what housing options are available for an individual or household. So we've listened, we've explored past strengths, and now we want to come up with a plan. That plan might entail, and these are some common outcomes, but certainly not the only. We really try to, like I said, remain client focused and treat each individual as a person that's in front of you and case specific. But there are some common themes that we do tend to see, and that might be going back to live with friends or family. It might be returning to your own residence. It could be that we've temporarily diverted, and that might only be a night or two while a household is seeking new housing. And then lastly, as I alluded to before, there's always a possibility if we can locate a safe permanent housing out with the natural supports out of town. And there's some pieces of the puzzle that have to be worked out there as well. We never want to send somebody from one homeless situation to another, but that is one of the other options for folks. So like I said, there are some common themes that we see in diversion plans that our providers are able to work out with those that are on the brink of homelessness. Utilizing natural supports. Sometimes it can be helping somebody get into a sober home. It can be helping them come up with shared housing with a roommate. And those are some scenarios that we work through, and I'm going to give you some of the specifics of how those conversations can happen for each of these individual diversion plans. So if it's a doubled up situation, a temporary situation where somebody's staying with a natural support, a family member or a friend, there are some questions that you would want to ask if you are comfortable and remaining trauma informed always, but some questions that you can ask about the living situation, because that can change the level of housing crisis that you can identify for the person or household. So what are the sleeping arrangements? Is the natural supports, are they living in their own rental unit where it's small? It might be a studio apartment and your client is sleeping on the floor in the kitchen. That's very different than having a comfy couch that you can sleep on for a month, or a spare bedroom. So asking some of those questions, again, if you're comfortable and you've established that trust and rapport with the client where you feel you're going to get some more information about their housing crisis. The physical space, again, we want to think about things about, you know, is this a place that's meant for human habitation? So is there running water? Are the heat and lights working? Is the plumbing reliable? Is there any issues with infestation? The behavioral health of the household. Is there a reason why this might not be a safe place if you're a parent for your children to be? Is there drug or alcohol abuse or sales within the home? So a lot of these, again, you want to make sure that you're being trauma informed and really reading the client or household's reaction to some of the questions and making sure that trauma informed remains our focus. But some of these can give you a broader sense of the housing crisis and give you some direction in how to go to alleviate even some of these. Can we pay a light bill for the natural support that you're staying with so that, you know, the lights being turned off is no longer an issue? Is there mediation that can happen with a landlord in regards to any infestation problems that we can work through so that it is a safe and stable environment, again, for the household or family? And I'll let Amber talk a little bit about some special considerations during the pandemic.
Yeah, so as we are currently in this pandemic, we have to add to that list. We have to have special considerations due to COVID. And normally our list would end there, but now with COVID, you have to ask additional questions and find out if anyone in the home that they have identified as a place where they can go, see if anyone in the home can possibly have a fever, see if there is any new or worsening cough or shortness of breath. If there's anyone in the house has any difficulty with breathing, you have to see if they had any contact with someone who was sick in the past 14 days. If they're on quarantine, we don't want to put someone in a unsafe or unhealthy situation. So, and also ask your individual that you're working with if they have any health conditions, if they have any blood disorder or kidney, liver, heart or lung disease, diabetes, high blood pressure, or any other condition that makes them, including any medication induced, because that makes them more susceptible to get COVID-19. And you also want to make sure that they are adhering to the precautions that are in place as far as social distancing, wearing a face mask, washing their hands regularly, because as we want to prevent an individual from, going into the shelter, and we want to be housing focused, as we said, we just want to make sure that they are also being safe and healthy, and we're not putting them in an unsafe situation. So those are just some additional considerations to have.
And so we're going to talk a little bit, very briefly, about some of those diversion possibilities or some plans that you can help put in place, and some of the logistics that go into each one of those diversion plans. So staying with family and friends can often require a little bit of mediation. So if a client says to you, they've been staying with mom, but the relationship is unhealthy, finding out what the root of that unhealthy relationship is. If you've created that trust and rapport with the client, offering to help pick up the phone, have a three-way call with whoever they've been staying with, to help educate them on our shelter system. Maybe there's no shelter beds available. Most often that will be the case. So talking with the natural supports, if the client is willing to allow you to do some of that mediation, to work through whatever the issues might be. And maybe that's just changing the conversation from can I come and live with you to can I come and stay with you temporarily, and here are the other action steps that are being put into place so that this will only be a temporary stay with the light at the end of the tunnel of the client's own stable housing coming out of it. Returning to your own residence can require, again, some mediation, but this looks very differently. This might be mediation with a landlord. So referring somebody to a fair housing attorney might be an option. Letting them know that a landlord cannot just go and change locks on you. Really educating on fair housing laws. educating on what housing court looks like. You know, there's definitely some gray area while the eviction moratorium is still in place, and we're helping folks work through whatever paperwork they might need to file in order to avoid eviction. And then lastly, there is the option sometimes, when appropriate, for some flexible funding, financial assistance to help folks stay in their own residence. Temporarily diverted can mean some different things. You know, as I said just now, family and friends are going to be more understandable if they know that there's a time frame that's attached to the stay. Also more amicable in allowing their loved ones to come and stay with them if they know what plan is in place, what steps are being taken to achieve more stable housing so that they don't have to stay with them for a longer period, extended period of time. We can, within our providers across the state, have different levels of providing assistance in the housing search. So we have some staff that's dedicated to looking for open units that landlords may have. Each of the providers work really hard to have really good working relationships with some landlords in their region, and so we may be able to provide some referrals to phone numbers, things like that, to get people connected to housing. And lastly, again, a temporary situation can be shortened for those that are at the poverty level that have a real difficult time in saving money. Flexible assistance can reduce the amount of time that is spent with a natural support if we can let them know that there's a potential for some assistance with a security deposit or other creative solutions for financial assistance, so that we can reduce the amount of time that a natural support is needed. Again, this is another option for some folks, only when appropriate, to help them relocate out of town. So somebody might say to you, I have an uncle, but he lives in Texas. I communicate with him kind of on and off. We had a good relationship, but I'm sure if I called him, he might be willing to help. And so if you can help pick up the phone, really verify that where the client is going to be stable for, at the very least, 1 month's time while the client can work to get back on their own feet. Thinking about things like asking whether that natural support out of state or further away has their own subsidized housing, whether their landlord would allow them to have friends or family come and stay for an extended period of time. We never want to send somebody to a situation that we think, upon putting together a housing plan, looks like it's going to be stable, but once they arrive there, finding out, you know, that there's maybe a 2-week rule that the landlord or the subsidized program has, and they can only stay there for a real quick minute, that's not really stable. So really making sure that you're asking all of those questions ahead of time before sending somebody off to another location. Working through the logistics of the trip, of the travel expenses. So if it's just a bus ticket or a plane ticket, how much does that cost? Is luggage available? Do they have a way to transport their belongings? Is there food security available to them during the trip? So do we need to purchase gift cards so that they can purchase food along the way? Really working through all of the logistics of that plan to make sure that it's a stable plan and it's going to work to fruition to a stable housing situation. Shared housing, again, that's thinking about roommate situations. If we have those conversations up front in advance of putting together a shared housing packet for somebody. So thinking about having formal written roommate agreements prior to moving in together. So things like who's responsible for what financial obligations, are there rules amongst the household of when can you have guests, how late in the evening can they stay? Really working through the household obligations and having a full understanding of what those are going to be before entering into a shared housing. And then there are options for some landlords who are willing to entertain allowing for separate leases, so that if one roommate falls behind on rent, and there's an eviction that needs to happen, that only the one that faulted on rent would be evicted, and the other client has the opportunity to find a new roommate so that they don't lose their housing as well. And I'll let Amber talk a little bit about the benefits of shared housing.
Yeah, there's many benefits that come along with shared housing. Oftentimes people don't really think about shared housing as an option, but we want to think outside the box and explore every single option that may be available. But there's financial benefits. It's a reduced rent burden. It's not just one person that's responsible for taking care of the entire rent. It's split in half, as well as the utilities. There's access to better neighborhoods because if it's two individuals that are splitting the rent, you can afford a apartment that is maybe in a better neighborhood. If someone has a child, you have another person there. Of course, you have to trust that individual that you're staying with, but they can assist you and you can assist them with childcare, and work together as a team with that, as well as transportation. Maybe if the other individual that you're staying with has a vehicle, you guys can carpool and not have to take public transportation. So there's a financial benefit that goes along with that. There's tons of interpersonal benefits that goes along with shared housing because it allows you to develop your support network. It reduces isolation. Sometimes people, they don't want to be by themselves. They don't want to live on their own. They like having someone else that's there with them, and it reduces stress because you have someone else that's there. You're not isolated. Especially think about going through COVID right now and having to stay inside. Then if someone lived with someone else, they won't be so isolated. And it helps them with reducing their stress because they have someone else that's there. Now, of course, you have to get along with that person if you're going to be spending so much time together, especially during the time of COVID. But it does help with interpersonal. Also, if someone is a part of a housing program, there's many provider benefits because it reduces the length of stay that someone may have in the shelter. It's also a solution to battle low vacancy rates and high rent because it's less units that we're looking for. It's less one bedroom units that we have to find. Instead, it's two individuals that are going into a place. So there's more housing stock available for others. And we do have additional resources on our website about shared housing, but shared housing is definitely something that many people don't really explore, and there's tons of benefits to it.
So while our focus across the state of Connecticut is housing first, and really we're working to help folks come up with a housing stabilization plan, that doesn't mean that housing first means housing only. And so there may be other services that are available within your local community that you can refer your client to that will assist them in resolving their crisis. So I encourage you to really take some time to do some resource mapping within your local region. So thinking about where are your local job centers, your local temp agencies, can you reach out to them and make connections with the folks that work there? Are there childcare options that you can identify? Can you help your client with, lengthy application processes like Care for Kids application? Knowing your local substance abuse treatment centers and how clients can gain access to the services that are available there. I encourage you to try and use the GMIS access line. I've given you the 800 number here. I've had my own personal successes and failures in using, substance abuse treatment referrals. Similarly to our homeless response system, there's limited resources. So you really want to make sure that when somebody identifies to you that they are looking for some treatment services, really knowing where to point them in the right direction and help them advocate for themselves to get the services that they need. Knowing your local city fair housing officer or technician, depending on your region and your local municipality, they might title that person differently, but It's usually located within your city hall or community services, human services office, but knowing who that local contact is and having their contact information to be able to provide, reaching out to that person to say, is it okay if I refer my clients to you, and what are the eligibility requirements, so that you know those things ahead of time. Looking into adult education services in your region, what services are available specific to veterans experiencing homelessness, knowing how to access elderly protective services. And this is just a broad overview of a list, but really working hard within your region to know, again, like your local McKinney-Vento, that is within the public school system. That's a liaison that can help families that are in unstable housing situations to access services within the school system. So there's a wealth of resources. It's just knowing how to access them and who the right referral contact information is to have on hand, and keeping that updated. 211, you know, you're going to think, well, that's how the client ended up in front of me, because they are in housing crisis, they called 211. So why would I refer them back to 211? But I want to really point out that 211 is a wealth of resources, not just housing resources. And the 211 website is a great search engine where you can find region-specific services. So you can just type in what you're looking for, whether or not that's a basic needs clothing closet, a food pantry, soup kitchen, employment services, and you can find that pretty quickly just by typing in your zip code or your city and what services you're looking for. And 211 does a really great job of making sure that those resources, region specific, are up to date. So that's another great place to look if you're looking for some additional help. Similarly, and again, I'll point to, you know, pre-pandemic, how things were a little bit different. You could walk into your local community services office or your local public library or your DSS, community action agency, but those organizations always within your regions are going to work really hard also to know what resource mapping is available, what other referrals are available that are region specific. So making sure that you have connections at those places is really important. And hopefully we'll come out of this pandemic and be able to see people in person again soon. And when that happens, all of these offices have, you know, lobbies where you can sit and wait, and oftentimes have a bulletin board that people can post local resources and phone numbers and things. And that's a great place to look for additional region-specific resources. And that brings us to how to access flexible financial assistance through CCAH. We administer different pots of flexible financial assistance within our organization. One being our Youth Homelessness Demonstration Project, that is financial assistance available for rapid exit and shelter diversion, specific to young adults that are ages 18 to 24. We have youth programs, again, broken up within our 7 cans with youth navigators and staff available to help that specific population. The way to access that, again, is to start by calling 211. Shelter diversion pre-pandemic was specific to help families with children under the age of 18 or minor dependents to keep them from experiencing episodes of homelessness or entering shelter. When the pandemic hit, we were able to find further funding sources to open up those flexible financial assistance programs to individuals as well. And rapid exit, again, all of these are dependent on the funding that's available at any moment in time. But rapid exit is to help families and individuals, if they have to enter shelter, to rapidly exit them with a little bit of financial assistance as quick as possible. So what's needed for you to be able to access our financial assistance? First off, your agency must have a signed MOU with CCH. That is a memorandum of understanding. It is a contract between the agency and CCH that outlines the responsibilities of each party in order to access some financial assistance for the clients that you're serving. The staff that is completing the request for assistance must have attended CCH diversion training and be well versed in that problem solving conversation. And your agency will also need to have access to our database, that is HMIS, and client records for data collection. Allowable expenses, depending on our grant funding sources for each individual pot of flexible financial assistance, it can vary a little bit, but we really try to encourage thinking outside the box, creative problem solving. Oftentimes the requests are coming in for security deposits, first month's rent, and we recognize that there's a need for that, especially for those that are very low income, but it's not exclusive to that. We can also help out with utility costs, rental application fees, moving expenses. As Amber mentioned briefly, we have a new grant from PetSmart we're really happy to be working with, and it's an innovative thing that we're doing in Connecticut to really focus on pets as being barriers that should not be a barrier to housing for those. You know, oftentimes we find folks that are living outside that have a dog as a companion, unwilling to enter shelter because of that. So there's a lot of things that we can work out, creative solutions for those that are experiencing a barrier to housing because of a pet. Transportation expenses, that can be anything from car repairs to bus passes. We can help with childcare costs, but really it's anything that you can identify that can be associated with achieving shelter diversion, as long as it's included in a housing stabilization plan. It has to be housing focused. So diversion is not always going to be possible for you, and that's not to make you feel bad about the conversation and all the work that you've had done with any household or individual, but to really know the steps that you need to take if you are unable to help resolve their housing crisis and unable to divert. You want to make sure that if you're working with somebody that's unsheltered or living out on the street, that they have been connected to a client CAN outreach worker. That can happen through the natural process of calling 211 and going through the system, but really asking the right questions to make sure that anybody who's been through the system is still connected to somebody who can give them access to housing interventions or other services. Within the time of COVID, we really try to work hard to make sure that we stay connected to the clients that are in need. And so making sure that their contact information is accurate. Oftentimes those that are bouncing from house to house or living unsheltered, it's difficult to keep track of your belongings. They may lose their phone. So really, when it's appropriate, making sure that they're providing an email address, really asking those questions. Do you have an email that we can follow up with you on? If they don't, it's a simple few minutes of your time that you can assist somebody in creating a Gmail account that's free. So thinking about, you know, some of those other ways that we can remain in contact to help somebody that, you know, even if we've only temporarily diverted them for a couple of nights, that we make sure that we're following up and helping to come up with that housing plan. Giving a client on the reverse side of things a way to check in with you. And so maybe because of your agency, many of us are working from home these days. They can't just pop into your office. So making sure that they also have your contact information, email. If you have the ability to text with clients, that's always going to be really beneficial. Many of the clients at the poverty level are working off of state phones that have limited minutes. So really trying to make sure that you give them as many options as possible for them to be able to follow up with you as well. The client should never leave the conversation that you've had together and feeling that their only way to connect back to services is to call 211 again. And I'll head it back to Amber. That brings us to the end of the presentation, but we thankfully have about 15 minutes left for some question and answer.
Yes, so if you have not put any questions in, please do so now. I'm going to see what questions we currently have in the box. So Diana, and I don't know if you're going to know at the top of your head, can you please remind us what ACES stands for?
You're right, Amber. I don't have that at the top of my head, but I can get it. Really, we work in this homeless response system and we work in acronyms all the time, oftentimes forgetting to know what the acronym actually stands for. But really, it's an assessment tool to measure trauma in children and how that affects their health outcomes.
Great, that works. Thank you. Another
Sure.
question is, what happens when the person is unemployed and they are looking for vouchers and services?
Yeah, so that word voucher sends a red flag my way. We find that, within the homeless population, within those that are in crisis, word of mouth is prevalent. And so somebody might say to you, I had a cousin who went through the system and they got a voucher. Well, what does that mean? It can mean anything from, they received some assistance with a security deposit to maybe they got matched to a up to 6 months rapid rehousing program, and the eligibility requirements for either of those programs differs. So I would encourage you to educate your client on the homeless response system and really emphasizing that we prioritize resources for those that are most in need. So somebody that's sleeping out on the street that's already been experiencing homelessness for some time might qualify for a different level of intervention. And again, I bring it back to those different levels of housing crisis and different levels of intervention and services that might be needed for somebody. So really trying to make sure that we educate the general public and the clients that we serve as to what those housing interventions might look like and what might be appropriate for somebody.
Great, thank you. And actually, someone just gave us some information that ACCESS stands for Adverse Childhood Experiences. So thank you.
Thank you.
Also, we have a question as far as, let's see, we know we said that we will assist the individual with being diverted to another state if they have a family member or friend that they can stay with, but will we also assist them with setting them up with new resources in that new state?
When you can, absolutely. Speaking with that natural support on the other end of the phone, what state are they in? Do they have a local community services office that the client can walk into? Do they know of employment services in their region? Sure. It's not a requirement of diverting somebody to somewhere else, but like I said, we really try to take all precautions that we're never sending somebody from one homeless situation into another. So yes, resource connections can be really great in those. We don't expect you to know what resources are available in other areas, but pointing the client in the right direction can certainly be beneficial to them.
Thank you. And Diana, I know that you are handling our financial requests and doing a great job of that, but is there any particular turnaround time that we have for financial diversion requests?
Yeah, that's been a question that we've had to field quite a bit over the past year. As many of you that are working for homeless response agencies, are working from home, so are we at CCH. So we're limiting the staff that is in office. So the process of receiving a request to the time that we're able to cut a check to oftentimes it's a lag time within the postal service. We try to get checks out. We try to get financial assistance out to individuals and households as quick as possible. We've worked through this pandemic and our internal processes to make sure that we're doing everything on our end to make sure that those assistance checks get out as quick as we can. But it used to be that we tried to do a 2 business day turnaround. Oftentimes it's more like a week. And again, we've had lots of, pandemic issues, pandemic related issues to getting those checks out as quickly as we'd like.
Okay. And when someone is submitting a request, do they have to provide a proof of employment for the individual or proof of unemployment?
There's no financial requirements to qualify for financial assistance. Somebody that has no income might still qualify for, help with a friend's utility bill because they're staying with them and we want to extend their stay longer. So there's no financial requirement for assistance. The Memorandum of Understanding contract between an agency and CCH outlines the documentation that's required for you to keep on file for any client that you are assisting. So, things like pay stubs or letters from the employer are things that we would expect you to keep on file. A housing stabilization plan is something that is needed for that client documentation. But again, all of that is outlined within the MOU that you would have between your agency and CCH.
Okay, perfect. And I don't see any other questions coming in. So if you have any more, can you please enter them? I'll just go over some basic stuff. I do see the standard questions that we get. Is this being recorded? Yes, it is. Will these slides be available and sent out? The slides will be available on our webinar library on our website, www.cceh.org. When you go to our website, you'll see a resource tab, and that will bring you to our webinar library, where you'll see all of our different previously recorded trainings, and the slides will be attached. And I still don't see any more questions, so I think we're going to close out. But before we do, we had a good amount of people that joined us today, so thank you all for joining us. I will say that this was pretty much just the introduction to Shelter Diversion. We will be having a Shelter Diversion 2.0 training on April 8th, same time, 11 to 12:30. And that one, I'll let Diana speak more to it, but that one is going to go into more detail. We pretty much just, set the foundation of what Shelter Diversion is, but the next one is a step up where we'll actually do a little bit more practice work, go over some scenarios and all of that. But Diana is our specialist when it comes to Shelter Diversion. So is there anything that I missed as far as what 2.0 will really entail?
I think you covered the basics of it. Yeah, we'll go into a little more practice. Like you said, some common scenarios that you'll encounter, those that are experiencing homelessness, and some levels of resources and referrals that you can do based on those scenarios. We'll go into a little bit more detail on the diversion workflow in HMIS for the providers, a little more detail on how and when to do things like creating case notes and documenting. So really geared a little bit more towards the providers that are doing the diversion specialist work at the front door.
Okay. And I will say providers, as well as we have a lot of other individuals here from municipalities. We encourage you all to use these diversion practices as well. It might not all apply to you, but practicing how to have that shelter diversion will be really beneficial for you. So our contact information is on the slide in front of you, Diana's information, and you can also contact me at training@cch.org or afreeman@cch.org. If you don't have the link for the April 8th training and you would like to register, please email me and I can send you that out. It will also be on our calendar, training calendar, and you can access it there. So we are going to close out. So thank you all for joining us and take care.
Thank you.